Hello friends, this is Dr. R.B. Kusoha, Professor in the Division of Veterinary Clinical Complex at FBSC and AH Squash Jammu Araspura. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe the channel and hit the bell icon for further notification. So today we are going to perform a cesarean section in a adult cow. So the history of this cow, that cow completed the gestation period 10 days, but despite all effort unable to give the birth to the fetus. So then he brought this animal here. So gynecologist examined and they come to conclusion that there was a torsion. So they retort the torsion, but even after the torsion the cervix is very tight and it is unable to open after giving the cervix dilator. So we decided that we go for the cesarean section. Cesarean section we can perform in standing position or in the recumbent. So today I am going to perform this procedure in the standing position. So I have prepared this left side paralumbar fossa as well as the lower flank area for the surgery. We have just given the paravertebral nerve block. So normally paravertebral nerve block, the effect achieved in the 20 to 25 minutes. So the effect has started because if you see, so there is a curvature of the vertebral column. So this is the good indicator that up to certain extent effect of the paravertebral nerve block has been achieved. So now we have applied the sterile drape over the surgical site. So now you could see, so this one is the left paralumbar fossa, this one is the last rib, this is the transverse process of the lumbar vertebrae. For the cesarean section in a standing position, the lower flank incision is desired. So now you could see, so there is no sensation in the skin. Otherwise what happens if there is a sensation? So there is a reflex contraction of the skin, but here even upon the pressure there is no sensation, no reflex contraction. It means the effect of paravertebral nerve block has been achieved. And as per the gynecologist, the fetus is live, and this is the reason why I have chosen this standing approach for the cesarean section. So we start the incision from here to here. So now I could see the effect. So this is the skin incision. After that, then the muscles incision. Give the seizure. So these are the abdominal muscles, external, internal, oblique. So here muscles are located in the, placed in the crisscross fashion. So whenever you cut the muscles here, so now you could see, so this is the transverse fascia and the peritoneum. This is structure which is visible here. Give the drape. So it's okay. Please someone give the release tissue forceps. Release tissue forceps. Give the seizure. Now could see, so this is the peritoneum. So this structure, this is the rumen. We should not confuse with the uterus. This is the rumen. You could see the branches of this blood supply. So here the fluid is present little bit. So I will try to lift the uterus. Please someone come here. Astos, please come here. Try to push pull the woman towards you. Leave it. So now you could see here, so I have holded this part of the uterus along with this fetal part. So this is the most probably the limb. It would be always better if I able to sterilize this one. If someone come here, ask for, you just push it now. Give the drape, then a drape. Leave it. So here we cover this lumen part. So this part is difficult to sterilize up to the level of this incision site, and this is the most common drawback of this standing cesarean. Give the blade, BP blade. उस साइड से पकड़ लो, फीटस को पकड़ लो. Just try to hold. So here I am giving the carefully the incision because the fetus is live, so we should not cut any part of the fetus. Give the seizure. Very good. Just hold it. Even if the fetus is live, so some of the part is go inside, there is no problem because this is all supposed to be. And simultaneously you hold the uterus. You should not leave the uterus. Hold the uterus. Hold the uterus. Very good. So this one is the 1/4 limb, and this one is the second 4 limb. Now you pull, the head is not coming. This is the uterus. So fetus is live. You could see there's a reflex. So this is the uterus. So we have to remove the this placenta and then we suture. So the fetus is live, and as per the gynecology, the fetus was live. So that's why I taken these steps. So only problem in standing that sometimes it is very difficult to strive this uterus up to the incision, or sometimes it retract back into the peritoneal cavity. Since the fetus was live, so there is no problem. Even some part of its bone inside the peritoneal cavity, there won't be any harm because this is all the live. Yes, come here. Go. So just remove this one last. Give the artery forceps. Even we could apply the traction like this. Over the placenta. So in this way, almost we have removed the placenta. So now next step is to repair the uterus. Now uterus can rise very quickly from the incision site. Tanupriya, come here. Yes. Pass me. So now you could see this is the one edge of the incision site, and this is the other one. So we start switching from here. So Astos come to this side. Come to this side. Or pull karo. Tanupriya, come this side. Yes. Or pull karo beta. You see from here. In the meantime, someone make ready this Furia bolus, 4 bolus for the. So this is how. Now, Tanupriya, you leave the skin and hold this thread. Leave the skin. Skin को छोड़ दो. Skin को छोड़ दो. So this is the suturing of the first layer, suturing of this uterus. So this is the Lambert pattern. So this is the Lambert pattern. You could see the bite is being taken at the right angle of the incision. I'll give the Furia bolus, 4 bolus.
सारे हाथ में
मेरे हाथ में डाल दो बेटा. So this is the 4 Furia bolus. So we put inside here. This is nothing. This is a antibiotic. And in standing procedure, it is very difficult to give the incision at the desired side, that is the greater curvature of the uterus. So whatever the uterus part you able to extrude or able to face, you have to give the incision on that portion. So this is the drawback of the standing. Each position have its own advantage and disadvantage. So whenever the fetus is live, then you can go with the standing. I am really happy with this paravertebral nerve block, effect of the paravertebral nerve block. If you want to see detailed video of the paravertebral nerve block, how it is to be induced, so you can watch the video which I have already uploaded. Give the seizure. You hold from here, Astosh. Hold and pull. Even you could see the contraction in the uterus. So last video which I have already uploaded on cesarean section, that case was very difficult and the uterus was not very good, and that even the fetus was dead and macerated. So but in this case you could see the condition of the uterus, which is very good. So this is the first layer which we applied in the Lambert. So this one is the second layer. ट्रॉली इधर कर दो। So now we have to bury this here. So this is the Cushing pattern. Cushing pattern means it is a parallel to the incision line, and the bite is only the partially. It should not be. You take the bite in the full thickness of this uterus. So here slide there is a deviation of the incision, and this is not in the full thickness, and this is the reason why there is a tearing here. खींचो, पुल करो, यस। Better to revert the hair the maximum portion like this. Yes, very good. Now from here onward, it's very easy. Yes. Pull the uterus. जितना खींच सकते हो उतना खींचो। इंग्रेशन हो रहा है ना, दिस इज द प्रॉब्लम। वंस यू डिलीवर द fetus, so there is a contraction of the uterus. So this is the reason there is difficulty in the suturing of the cervical line. Even you could see here, so there is a tearing. Could be because of the little bit delayed case as per the inner history. The maturation time already passed 10 days back. So we almost reach. Now hold from here. Pull further little bit. थोड़ा सा पुल करो बेटा। Because of the involution of the uterus very rapidly, so there you can see the. So we have reached up to this side. So here we are just putting the knot. दिख नहीं रहा है यहाँ पर? दिख रहा है? There is no light. So we have completed this suturing of the uterus. Hold it. This one. So now you could see. So we have repaired this uterus in the 2 layer. So we'll place in the abdominal cavity here, and then next is the repair of this incision site. Going to repair this laparotomy incision. So here I will try to repair in a single layer. So this is the number 1 polyglycolic acid. This is the alcohol or Vicryl?
Icon.
So in alcohol, so there is a PGA, polyglycolic acid. So this is the polyglycolic acid. This is the multifilament suture. And the size is number 1. You hold like this. Now hold this one on. So here the many surgeon they prefer the lock stitch, continuous lock stitch, but I prefer the simple continuous. So definitely in a standing position the suturing of the abdominal wall become easier as compared to the para median approach. Continue.
सर्जन का काम है वहाँ सर्जन का
नहीं मेरे कहने का मतलब है कि इसको क्या हुआ थोड़ा सा मैं एक्सप्लेन कर दीजिए ना।
ये तो बेचारे लगे ही थे संग में, लेकिन ये है कि कल ऑपरेशन कराना पड़ता तो ये बच्चा नहीं मिलता हमें। जो परवेजेंटली मैंने चेक किया और मैंने डॉक्टर साहब को भी बताया था, यही बताया था कि डॉक्टर साहब अगर आज हो जाएगा ऑपरेशन तो हमें लाइव फीटस मिल जाएगा।
तो एज पर द गायनेकोलॉजिस्ट व्हाट ही इज सेइंग दैट इफ यू वेट फॉर द next day or 1 day or more, even the 24 hour, so there may be chance that fetus could die. And the skin is slightly shorter as compared to the muscles. Then to repair the muscles, just hold slightly. Mop it here. So we close the hair. Suture material. Not a subcuticular suture from this ventral commission of the incision. Cut it from the pass. So from here onward, I will take the bite in a such a way that the skin approaches close together, as well as there will be no dead space. So here definitely in the standing position, the suturing of this abdominal incision is very easy if you compare with the paramedian approach or the lower flank oblique approach. Like this to obliterate the dead space. Of it. So now we reach at the dorsal extremity of this incision or proximal extremity. So closure of abdominal incision is depending on the surgeon, subsurgeon. They prefer to repair in the 3-layer. I here repair in the 2-layer. So there is a variation, and that is no harm in that one. Leave it. Close this abdominal muscles. Now next is the closure of the this skin. So again, the suture of the skin, you can go with the horizontal mattress, vertical mattress, cross mattress, or simple interrupted. So here you could see I am going with this simple interrupted. Cut it. थोड़ा और बड़ा, हाँ. So cross mattress pattern is very good in case of the buffalo, because the buffalo skin is very thick. So here you could see how you could place the knot at one side of the incision. We have finished the procedure of cesarean section in a standing position. So you could see this is the final skin suture. So thank you very much for watching this video, and if you like the procedure, so kindly share with your friends and subscribe the channel if you have not subscribed yet. Thank you very much. Suckling reflex.
Well,